I'm kind of fascinated by healthcare in general, and we've done some episodes on it. I have a general view that government has destroyed the healthcare system in the U.S., that the free market has created so many fantastic solutions in so many different arenas, but we just don't allow it to do its job in healthcare because of the insurance companies and how we put them in the center of everything in healthcare. And Obamacare just quadrupled the importance of insurance companies. And so insurance companies aren't great for free market. And of course, the government's not great for free market. And, here we are, with COVID. And I definitely would like to kind of keep COVID kind of at the center of this to some extent, because I know, COVID has now opened the door to telemedicine, which is something that probably should have been done a long time ago. The last thing I'll throw in to get all of my things out, and then you can start addressing some of these, is recognizing the importance of the internet and Google. I've been in the doctor's office on a couple of occasions where the doctor literally Googled something in front of me. And that didn't offend me. I thought it was great that they didn't have such, pride that they couldn't just go to Google and Google it right in front of me. And so we need to recognize the changes that have happened and take advantage of these new technologies. And there just seem to me that they're not being taken advantage of. Did I say enough?
Oh, you said a lot. I mean, that was a super hot take. Okay, so let's kind of go through these one by one. I address this in the book that I just wrote, The Mega Factory of Healthcare, about government overreach. And I really think that when you're dealing with a generational problem like healthcare, and this is not something that can be dealt with by a senator who's in Congress for 6 years, it definitely can't be handled by a congressman or congresswoman who's in the House for 2 years. Or even a president that's there for 8 years, right? This is generational issues, and every time that they get involved, whether Republicans or Democrats, they screw it up, right? They can't get out of their own way. We saw in the financial markets how they got rid of some of the governmental overreach, and it had its good points and its bad points, but ultimately it created the greatest wealth of any generation in the last 100 years, and really last 30 years, even more so. So I'm on the same page with you. I think that the government regulations have confused and slowed down the way that we have excelled as a nation and in healthcare.
And talk specifically about the insurance companies and how we've put them in the center of all healthcare. So there's always this middleman. There's either the government is the middleman between you and your doctor, or a huge insurance company is the middleman.
Well, I look at it from a little bit of a different perspective. We look at incentivization and penalization, and who's incentivized for care and who's penalized if care isn't given properly. And so what we've created is a system by which insurance companies have been able to profit by ensuring that they don't pay as much as possible. And what do I mean by that? So they've created a model for what we call fee-for-service, which is you get the physician group or the hospital gets paid a certain amount for every time they visit every time a patient visits. And that has led to now what's called quality payments, which is loosely based upon a framework where the physician is trying to do the best possible quality, but it's really checking off boxes on those visits. Ultimately, what has happened is that the insurance companies are winning on both sides of that, because patients are visiting less and not utilizing the system in the best way possible, which makes them less healthy. I think that the insurance companies are are not the only ones to blame in this mix. Again, I go back to the government regulations. We have no real price transparency. That has a lot to do with what are called reimbursement rates, which are the rates that the insurance companies pay the physicians for services that are rendered. You're not allowed to share openly what your reimbursement rates are from an individual insurance company. And from a hospital perspective, you're incentivized not to share it because you're getting paid very well off of services that independent physician groups or smaller physicians are getting paid a lot less because of size. And so, the fact that we're not at a point where we're penalizing people for being transparent in their prices is also a problem. So, it's cyclical. As we continue to allow lobbying in healthcare, as we continue to allow this to be a political football, it will be an issue.
Yeah, well, look, anytime you have the government sticking its nose into the private sector, then the private sector is going to have an incentive to try to lobby the government. So it's only natural. You can't criticize, in my opinion, anybody for trying to lobby the government. Number one, because they're doing it for the sake of their business, and that's what business is supposed to do. But I always say the problem is if you're concerned about lobbying, then get the government out of it, and then there'll be no lobbying. Because you're always going to have lobbying. You're always going to have the ability to talk to your congressman or what have you, and unless you get rid of campaign contributions, you're going to have that issue. So I always say that the problem is the government sticking its nose into things it shouldn't be sticking its nose into.
Yeah, I mean, there's sticking your nose into things, and then there's sticking your nose into things. Right. I think that there's a difference here. You can restrict the amount of lobbying that goes on and the amount of jump from going from Congress or going from governmental jobs into the private sector and healthcare, just like you do in the DoD and in private security and in national security spaces. Right. So, but we're not doing that in healthcare.
Yeah, I'm sorry. I guess what I mean to say is that's a Band-Aid to try to cover up what the real problem is, and the real problem is the government being way too involved in healthcare. So yeah, you could stick a Band-Aid on it and say, oh, gee, let's not let the lobbyists talk to them too much when they sit around deciding what to do with our healthcare next, like expand Obamacare or expand requirements or this or that, and don't let them lobby. But in my opinion, that's a Band-Aid. We need some deep surgery here, as you point out, that is generational. We got a generational problem here. We don't need Band-Aids. We need to go in and we need a heart replacement surgery.
Yeah, I think that, look, trying to make wholesale changes as it relates to governmental overreach in healthcare is just going to be a failing endeavor right now. We need to find the surgical strikes that we can work with in the current environment to make small, steady progress in changing the continuum, educating consumers on both the quality of a physician group, educating consumers on pricing, educating employers on how to handle pricing for their employees, and then providing care in a way that is much different. Technology has a lot to do with that, but just the mindset of how we're presenting healthcare also needs to change. And that really has to do with as you said, it's okay to Google things. It's okay to utilize technology as a supporting factor in how the healthcare is provided. We're seeing a lot of that right now with AI diagnosis for different cancers, for directed care. A lot of the things that we've seen in the last year with COVID is technology that's been around for a long time, but consumers weren't interested in it because there was no need for it. And as we have had a need for it, the demand has skyrocketed. And I don't think that certain things like telemedicine are definitely going to go away. It's how we are going to deliver the telemedicine that's going to be really the game changer.
So I know that your book is very comprehensive, and it includes kind of the history of healthcare in America. What's kind of the one thing that you could point to where healthcare in America took a wrong turn and kind of has never come back?
I think it's the idea that you can have a system that is a three-legged stool without one of the legs. And I talk about this in a couple of places in the book, where we are incentivizing and penalizing physician groups, physicians, healthcare organizations. We're incentivizing and penalizing insurance companies, but we're really not incentivizing or penalizing patients, except in their pocketbook when they go to visit a doctor, right? So we have set up a whole ecosystem around avoiding a doctor because people don't want to pay. And on the delivery side, we've created a whole system where you want to get the patient in, and we incentivize them to get them in for preventative care or to get them out of the hospital as quickly as possible and not readmit them. But there's no equality in where they want that delivery to happen, and so that's where I think it really went wrong.
But I would think that insurance causes people to go to the doctor more often rather than less because it's free. If I have insurance, it doesn't cost me anything to go to the doctor, and so I'm more inclined to use it. No?
Yeah, it's not necessarily going to the doctor. It's going to seek out care in the wrong venues. Going to an urgent care to be your primary care doctor, or going to a doc in the box, or going to the emergency department isn't the best utilization of care if you can get it done with a higher level of quality at your internist's office. But the internist's office may not have the flexibility to bring you in when you need to come in, or there's just no availability of internists. I mean, it's cyclical, right? You have all these different specialties that the compensation is so high, and it allows the physician to work less, and so because they're making so much money off of the things that they're doing, and so patients are stuck trying to get appointments when they're not available. And so yeah, there's no equal measure in the different parts of the system.
It's funny that we're not having this conversation about, and I could pick a whole host of things, but just say electronics. We're not talking about how difficult it is to go get a TV when you need a new TV, or how hard it is to find this type of computer, or to hook up to the internet, or to find a cable company. We're not having this conversation about that because we don't have the insurance companies between us and which television you're going to buy. We don't have the government dictating that if you're going to sell a television, it better have this feature and 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 this feature. Otherwise, you're not allowed to sell televisions. The reason you don't have these efficiencies, I mean, you're explaining that, oh, you might not be able to get an appointment. I mean, that doesn't make any sense. In a free market, everything adjusts. Supply and demand.
Well, I'll challenge you on that. I'll challenge you on that, because we do have the FCC in place, and we do have the Consumer Protection Bureau, and we do have lemon laws in this country around those consumer electronics. But also the biggest difference is when you walk into a Best Buy, you know exactly how much a TV is going to cost before you walk out.
Exactly. And so let's just stop right there.
Issue.
Exactly. And why is that? Why isn't the price there when you walk into the doctor's office?
And it goes back to that price transparency issue, where we're not ensuring that the right price is being provided.
But hold on, insurance. I have to say that when you say we are not doing that, why is it not happening? It's because the free market has been destroyed in that. That's why.
Actually, there's laws around it, right? Up until the last couple of years.
Laws. That's destroying the free market. That's my point.
Yep.
Yes, there's, of course, every element of business is regulated to an extent and probably over-regulated. But when it comes to healthcare, it's off the charts. The regulation of healthcare. You just pointed out it's because of laws government sticking its nose in it that we don't have prices at the doctor's office, yet we have them at Best Buy.
Yeah, but it's the people who are lobbying to keep those laws that are the real issue.
I totally disagree. It's the government doing it. You need the government out. So what that you have somebody telling you should do it this way? As a senator or a congressman, are you obligated to do what a lobbyist says? I think you're talking about a band-aid. The problem is the government putting these things in place, not the lobbyists asking for it.
Yeah, well, we can agree to disagree on this one, but I know that the healthcare organizations, the huge hospitals and mega hospitals in these countries are really happy that there's not price transparency and don't want their prices having to be out there before you walk into surgery because people would balk.
Okay, and I blame the politicians that are giving them what they want. That's who I blame.
I blame the politicians too, but I think that we need to recognize that there is an impetus on the part of the hospitals. Where are the employers? Let's just step back here. Where are the big employers? Every single Fortune 500 company in this country right now is self-insured. Where are they standing up and saying, Mr. Congressman, Mr. Senator, I want my prices for all of my employees to be transparent? That's not happening.
Yeah, well, again,
and that's the free market right there.
Right. So government has destroyed the free market in healthcare. If you want to say they did it because of lobbyists, I'll go with that. So it was lobbyists. I don't care. It's the government that did it, and it's the government that needs to change it.
Yeah, and I think it's one of those cases where it's very complicated and people can't understand it to go out and fight it. And that's what I'm trying to educate people on.
And let me just say this. I kind of keep things a bit high level as much as possible. But I know the solutions are very difficult. But it's like, why have we allowed the free market to get destroyed in healthcare, but not in automobiles and 1,000 other industries that we could talk about? Again, they're highly regulated, all probably too regulated. But for the most part, you got the free market, airlines, et cetera, lots of regulation, but the free market seems to be able to work. Why the hell did we destroy it when it comes to healthcare? And my only theory on how it got destroyed is the people who hate the free market, okay, and there's a lot of people out there that really hate the free market. They really hate it when it comes to healthcare because they find it so abhorrent that someone could turn a profit off of the health of another. And that's why you've got socialized medicine around the world. And that's why you have so many people clamoring for socialized medicine in the US, single payer, because they find it so abhorrent that somebody could turn a profit off of somebody's poor health. But guess what? Free market, for-profit principles is what's made America great in so many different industries, yet we're keeping it from making healthcare great.
Well, again, I'm going to challenge you on that because the biggest driver in our turnaround in the last 10, 15 years in this country has been healthcare more than any other industry. We have grown that sector and created new sectors within healthcare that were never thought of before the Affordable Care Act. So, to say that it really hasn't driven the free market, I don't necessarily agree with you. What I will say is that the overregulation is something that in the car industry, you understand how the economics work. In the airline industry, you understand how the economics work. In healthcare, it's very, very complicated, and the economics are really, really hard to understand because that's how it was created by insurance companies, by governmental regulations, and by physicians. Because it goes back to your point of why are we profiting off of healthcare? Why are we profiting off of taking care of somebody? In my previous job, I used to talk about my dark heart of my dark capitalist heart, my black heart. I would look at every patient that walked in and out of our offices as a dollar sign. And the physicians that I worked with looked at them as my patients. I take care of them. I want to care for them, and would want to write things off because that's how they took care of things, and that's how they took care of their patients. We have grown healthcare into a big business. and you can see how big of a business it's been over the past year as we've gone through COVID, and billions upon billions, more than any other time in our history, have been put into healthcare IT in the spaces that we're talking about.
Well, I have no problem with you looking at someone who walks in as a dollar sign, because the profit motive is the greatest generator of innovations that the world has ever seen. So
Absolutely.
our food companies look at people as dollar signs, and there's nothing more important to somebody's health than food. And you have McDonald's out there selling kind of crap food for you, and making a lot of money off of it. And then you've got some organic companies out there selling some terrific food for you and also turning a profit off of it. And people can make their own decision as to which one to go to. And we need to rely on people to make their individual decisions. But, of course, you're going to look at people with a dollar sign, and that's okay. Now, if you guys treat everybody poorly and it becomes clear that that hospital over there is just in it for the buck, I'm not going to go there anymore. I'm going to go to this other one that I really seem to get some value for my money. That people could, as you point out, your biggest point, which is really, we're in 1,000% agreement on this, is the price transparency and the quality transparency that you've got in almost every other industry, but that you don't have in healthcare. That people can't shop around, and they're not price conscious. To your point, they're not using the most efficient service for what their need is, because they don't care what the price is. The insurance company is paying for it, or the government is paying for it,
or their employer is paying for it and they don't realize it. And I want to get back to a point that you made a couple minutes ago, which is the idea of Medicare for all, or socialized medicine in this country. I don't think people really understand what the economic impact would be in the United States if that happened. And I correlate it at the same way that we would with the auto industry. When GM shuts down a product line, there is a huge economic impact to that in the areas in the country where those cars are manufactured. The people who are the parts distributors, the people who are making lunch for the people who work in that area, and on and on and on. If we were to reduce the number of payers in this country to one, that would reduce a huge amount of people who are actually working to support the current industry that we have. And the economic impact of that would be much higher than the savings, quote unquote, that we could potentially see over the long run of having one payer. I think it's a fallacy to think that we could have one payer in this country, because no one is going to support someone who is going to reduce the amount of jobs that will be in any given state, let alone all 50 states.
Well, and also you'd have to have a ton of people now working for the government doing those things. I mean, yes, maybe it's simpler to have a single payer, but you still got a ton of claims processing that has to happen, and you still got the same issues of somebody in between the patient and their doctor, and that is the government.
I mean, the argument is that Medicare is very efficient. Well, Medicare is very efficient because it deals with a very few amount of Americans, and it relates to the total number of Americans alive. And so, you're dealing with less claims, less people, but it also it leaves people out all the time. So,
Medicare fraud is when I think of the word fraud related with another word, it's Medicare fraud is the one that you always hear about. So it's probably the most percentage-wise defrauded institution in America.
Yeah, because it's an easy one to catch, because the people break it all the time because it's easy to find.
So do we really want the government? I guess my point is Medicare really working as well as people say when there's so much Medicare fraud?
I don't know. I think that there are parts of it that work, right? You look at the pre-Great Depression era, and how the elderly were treated in this country, and you see how well we treat them now, and you say, okay, I get why Medicare is around. But then you see the amount of fraud, the amount of abuse, the amount of money that we're spending on it, and you have to question it.
Well, and let me just ask you this question about Medicare, something I've never understood. Why is Medicare for everyone? Why does Bill Gates get Medicare? I'm, as you could probably tell, very anti-government getting involved in just about anything. But to the extent I might agree with some government is, the safety net. And by the way, I'm not even sure I agree with this because I'm not sure it's the most efficient thing. But let's just assume that I agree with the safety net, taking care of the poorest of the poor. Okay, that I get. Why take over the entire industry? Why say that every single person in America over the age of whatever it is, 60, 65, goes into Medicare? Why wouldn't you just take care of the poorest of the poor?
Because in the 20s, John Rockefeller wasn't going to take Medicare. He was going to pay for it out of his own pocket. And that's the problem that we have. That the ultra rich were ultra rich at the time, right? They came out of the Depression and they still had their money, albeit some of them had a lot less money, but the ones that had money had a ton of money. And so they never thought that we would have generations of such a large, as people have called them, the 1%. But forgetting the 1% for a second, what about the top 20% in the country? And so I totally agree with you. It's something that we should probably address very soon. But the problem is that that's not how the system has ever been designed, and it would. You're talking about an area where, again, I go back to the politicians who are in charge of this. They wouldn't go for it.
What about a system where you're talking about Medicare? I mean, it's always going to be more efficient if you had price transparency to just allow people, a healthcare savings account that they can monitor on their own and wisely use and shop around for services. And
most people aren't prepared to deal with a healthcare savings account. They don't know how to deal with it. They don't know how to deal with their own pocketbook in many cases. And so we're going to put that in the hands of people who are fiscally irresponsible. I don't know if I agree with that.
Well, if they're fiscally irresponsible, that's their problem. Government's job is not to take care of people. People's job is to take care of themselves. So they'll have to learn how to use a healthcare savings account.
Okay.
Is there a system out there that you can point to around the world that says America needs to be more like that?
This is going to be the craziest thing I'm ever going to say, but the Israeli system of healthcare is pretty spot on. It's a socialized system, but it's a socialized system with different levels and different layers of service based upon what you're paying into it. And I think that the biggest thing there is that, and this won't go over well in this country, is that people give up a certain level of privacy because all of their data is shared in a centralized system. Interoperability of healthcare records saves money. Interoperability of healthcare records saves lives, and it's the privacy concerns around healthcare data are too large in this country, and we have too many rights in that area that it would never fly.
So what you're saying is in Israel, as a part of getting this kind of free healthcare, you're signing a contract essentially that says that the government can see my private medical records and use them for the purposes of finding treatments for various things?
Yeah. So, for instance, with COVID, one of the ways that they were able to accelerate the distribution of vaccines was that they made a deal with Pfizer to be able to get all the data on every single patient that had been administered the Pfizer vaccine, and what the response was. Did they get COVID afterwards? What complicating factors did they have? Whether they were pregnant or obese or a smoker. they had reams of data or megabytes of data, gigabytes of data about the individual Israelis who had had the vaccine. We just don't have the infrastructure in the United States to be able to do that here. We can do it in health system sides, some of them, not most of them.
So going back to examples around the world, I don't particularly like the Israeli example, as you may guess. Is there any example out there where it's freer? The healthcare market is freer than it is in America?
My focus really hasn't been international; it's been domestic. So I really haven't studied the different. I know the Israeli healthcare system because I've spent some time there, but I really don't know internationally other cases.
Fair enough. You mentioned the Affordable Care Act, and I think you mentioned it in a positive way, but I'm not sure if I caught that correctly. What do you make of the Affordable Care Act, which they also call Obamacare, which is the one that essentially, I mean, the two major elements that I think came from it, please correct me or add to it, is that everyone was mandated to buy.
Yeah, I misspoke when I said the Affordable Care Act. I meant the American Reinvestment Act that came in the first 100 days of President Obama's first term.
Okay.
Yeah,
2008
I misspoke.
Financial scandal. So, okay, but let's talk about Affordable Care Act. So, the two major things that it did is it required every America, if you want to breathe the air of America, you have to buy this thing. Number one, and number two, even if you have a pre-existing condition, that can't be taken into consideration. They still have to sell you healthcare at the same price.
Correct. So I agree with the second one. I don't agree with the first one.
And tell me, I mean, how bad was this? How bad is it the fact that we're mandating everyone to buy health insurance?
So what happened, and I think you need to take a step back and look at this on a macro level to be able to understand what really happened post the Affordable Care Act. We had organizations that got from being large to being really, really big because the economics of healthcare dramatically changed. When you're talking about incentivization around quality, you needed a lot of patients and a lot of quote unquote covered lives to be able to take advantage of as a healthcare organization of this new world order called the Affordable Care Act or Obamacare. And so it went from making a large organization of being 50 to 100 physician groups to 300 to 1,000 physicians in a group. And so it consolidated a lot of the healthcare organizations in this country. Consolidation led to higher prices in many cases. And what it also did was preemptively, a lot of insurance companies on the non-self-insured raised rates because they felt like they couldn't compete with a quote unquote government plan. Ultimately, it never worked because there was no exchange. Spinning up an insurance company is not a profitable endeavor, and there was just, again, this is a generational change that needs to be made. And 8 years later, everything that was tried to, or even 4 years later, Congress overturned many of the things that they tried to do.
But isn't part of the reason why you had to be big is that if you're required to take on anyone, no matter what their pre-existing condition is, and I want to start mom and pop insurance company. First of all, you can't start mom and pop insurance company in America anymore because there's just too many regulations. It's just too much government.
The capital requirements are too high.
Too high, but relative mom and pop. One of the biggest problems is if I got to suddenly take on a bunch of people with brain cancer, where I need a pool of people, I need a huge pool of people because I need these people's money to help pay for this person's brain cancer. I'm not allowed to say no to these people with brain cancer. I got to sell them insurance at the same price as the healthy people. So I need a lot of healthy people. And hence the reason why some insurance companies went out of business, and hence the reason why you need such a large pool of people.
So let me correct something. It's not the same price. It's that you have to have them covered. You could charge more if they had a pre-existing condition.
Hold on. You're the expert.
coverage.
You're the expert. but I think you're wrong about that. I don't think that you can discriminate on price based on somebody having cancer. Otherwise, I'd say, okay, oh, you have cancer? $1 million. Thank you very much.
So if you're looking at this as an individual level, which there are very few people in this country who are buying insurance individually. I am not personally buying insurance. I am part of a plan that's part of my company.
Okay, I buy individuals. Let's talk about me. I buy individuals. All right.
So you're in the minority. You're in the actually ultra minority of people in this country. And so, yes, you would be community rated based upon your experience. And
the fact that I have brain cancer, they're not going to charge me a penny more because of my brain cancer.
If you're on the exchange, no, they would charge it based upon your economics.
Right. So that's very difficult for an insurance company to have to take on somebody with brain cancer.
But then let's go back.
Just to finish, before you would turn that person down. You would say... Yeah,
but in the reality, most people are not getting insurance individually. Most people are getting insurance from their companies. And companies are rated based upon their experience as a company. They can't deny any individual coverage, but they're going to have to pay a bigger price if their experience is worse than another company.
And just so I understand, even before Obamacare, if I was working at a company, I just joined the company, I got my new job, I got my benefits, and I've got brain cancer though. You're saying that I would still get covered, and I would get covered at the same price as everybody else, even pre-Obamacare?
Right, but the company would probably have to pay more.
It would go into their overall statistics. And Correct. Next year when they go to renew.
So what it does say is that a company couldn't deny you getting health care if you were a smoker or you were obese, which was happening.
So, and that's another problem, by the way. Is, I mean, Americans have no incentive to take care of their health. I mean, no financial incentive. Now you could say, oh, come on, Jim, you're being silly about financial incentive. People all care about their health. No. I can tell you.
No, they don't.
They don't. And I can tell you my personal example. I've had acid reflux, and I've had to go in for the scope and that kind of thing. I guarantee you, if I had to walk out of there and pay the $10,000 bills cash, it would make me think, Jim, maybe you should cut back on certain foods and so on, because that sucked having to pay that $10,000.
I mean, it goes back to what I was saying. It's two legs of a three-legged stool, and we're not incentivizing or penalizing the individuals and at all. They're not part of the quotient here.
Well, I got to wrap up. I'm sorry that we started late, but just we're going to promote your book, of course. But just I'll let you have the final word as far as what do you want people to know? What's the primary takeaway you want people to know as far as to start changing mindset in America that could ultimately lead to some improvements in our system?
Educate yourself on how the system works. Educate yourself on the economics of healthcare, how physician groups, how hospitals, how insurance companies make their money. And that's the first step. Know who your doctor works for. Are they independent? Do they work for a large group? Do they work for an insurance company? Do they work for a hospital? Understand the whole, all the pieces of the factory, as I like to call it, because understanding and educating is the first step. You can't make any change until you understand what you're working with.
Thank you again to Etan Walls. Please go to Amazon and buy his book if you want to learn more. The Mega Factory of Healthcare, available on Amazon. Thank you to our producer, Michael Parker. Thank you all for listening. We'll be back soon with another episode of The Hidden Truth Show.
Thank you for listening to The Hidden Truth Show with Jim Breslow. You can find us at hiddentruthshow.com. Follow us on Facebook, Twitter, and Instagram at Hidden Truth Show. Join us again next week for another episode of Hidden Truth Show with Jim Breslow.